Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to your health program. It's a live health program coming to you live, mashallah, from Ikra Studios here in Bradford. Welcome back, alhamdulillah. Before the break, we were discussing really the dynamics of depression, stress, anxiety, why people get this, and what you can do to kind of alleviate these symptoms. And I was mentioning that 21st century is a stressful century, no doubt, with the modern technologies and the modern demands on ourselves, modern inventions like the light bulbs, etc. You can stay awake at night for a long time. And that impacts your sleeping. You go into something called deep sleep, REM sleep, a lot later, and you're there very less, because this happens normally kind of an hour and a half after you fall asleep. You go into REM, which really is so good for your health. We go sleep late, so that doesn't occur, or it occurs very less. We wake up early. Our food is really abysmal, the quality of our food, that impacts us. So many things. Then we have modern stresses, things which are not in our control. There's a dua of Rasulullah which says, Allahumma inni as'aluka min al-khayri fuj'atan wa a'udhu bika min al-sharri fuj'atan. Oh Allah, we ask of you sudden good news, and we ask you to save us from sudden bad news. So you have stresses that can come about very, very easily. Allah keep us safe all the time. And these kind of things, modern day news. If you look at news, inna lillahi wa inna ilaihi, you see every single day, news, bad news. All you see is bad news, and that affects again your stress hormone cortisol. It increases it, it releases it. That plays havoc with all your other hormones, and pretty soon, you're having palpitations, you're having anxiety attacks, especially those people who are susceptible. So I was saying before the break that there's many things you can do for stress, and I mentioned increase omega-3 fatty acids. Especially children, before they go to school or after school or whenever you remember, really, omega-3 fatty acids, the mercury is very good. Every child should have omega-3 fatty acids. I was saying about the study that they did in the prison, where 1/3 of their budget, which was used for for controlling these inmates, their violence tendency, that decreased by 1/3. They became a lot more calmer. And then they did it, if I'm not mistaken, nationwide. The inmates, they gave them omega-3 fatty acids. Children with ADHD, or dyslexia, dyspraxia, attention deficit hyperactive disorder, one of the main things that helps these children, amongst other things, is omega-3 fatty acids. So we should all have omega-3 fatty acids, number one. Number two, we should have B vitamins, especially the ladies. B vitamins are so important. बाज़ ख़वातीन होती हैं कि उनके लिए घर से बाहर जाना, सड़क को पार करना, उनको बहुत दिक्कत होती है, उनको बल्कि वहशत हो जाती है, और एक किस्म का पैनिक अटैक होता है. They can't cross the road. Why? Because they have low levels of the B12s, B5s, biotin, pantothenic acid. It's low in them. So ladies especially this is what ladies should have every day, to be honest with you. A good dose of omega-3 fatty acids, a good dose of vitamin C, and a good multivitamin, which should encompass the B complex in there. If it doesn't have B complexes, you should add B complex to that. So a good omega-3 fatty acid, मच्छी का तेल, इसके साथ अच्छा multivitamin. ये multivitamin नहीं जो आपको ये सुपरमार्केट से मिलते हैं, ये तो बेचारे ग्रोसर होते हैं, इनको कुछ नहीं पता न्यूट्रिशन के बारे में. अच्छी कंपनियों से आप कि आप दवाइयाँ मंगवाएं. If I can mention, but I can't tell you these names because we get in trouble. But Google, one begins with B and ends with E. It's called BioCare. BioCare is a good company. So inso लें या Solga से लें. We've got a call waiting, and then we'll come back to this topic. Assalamu alaikum wa rahmatullah. Hello.
Walaikum assalam. How are you? Okay.
Alhamdulillah, bhai. How are you?
Yeah, alhamdulillah. Maybe TikTok. I was just watching you on TV. So I thought I might ring you because I haven't been feeling well. It's more than a month now, and I had all my tests. Like I've got blood tests for my heart, for my lungs, for my kidneys, and then उनको ऐसी चीज मिली नहीं है, कुछ मैं diagnosed नहीं हुआ किसी चीज से. So I thought I might ring you.
Well, you're welcome. You've rang me now. So what are your symptoms, bhai?
My all the time symptoms are like I feel pain in my head, in my jaws, under my eyes, on my cheekbones.
Which side?
Mostly
Which
I've
side,
got pain in my chest.
Is it both sides or is it one side?
Mostly on my left side, most
Okay.
of the time.
Okay.
Yeah.
And you're
और
pain in the
और
chest as well.
या और मैं मतलब कि मैं जब सांस लेता हूँ ना, ठीक है, मैं जब when I take a deep breath, तो मुझे chest में pain भी feel होती है. Or I'm passing urine after every 10 minutes. I'm going to toilet. I feel like going to toilet. So and I feel fatigued all the time.
So how old are you, bhai?
I'm 25.
Mashallah. You got a very good age, mashallah. Have you been to your GP? Have you been to casualty with this pain on the left hand side? Is it that pain going
Yeah,
down your left hand side arm as well?
yeah. Arm as well. Yeah. I've been
Oh,
to
as well.
GP a couple of times. I got an appointment. Yeah, first they said I've got stomach infection, and then they gave me some antibiotics for that. I've done the course, and then they
What
said I've got.
infection did you have, brother? Helicobacter pylori or कौन सा था?
मुझे मुझे उन्होंने सही से मुझे याद नहीं है ना, उन्होंने मुझे सही से बताया, बस मुझे ये बोला कि आपको स्टमक इन्फेक्शन है, ठीक है, बिकॉज आई गेव द स्टूल सैंपल, तो मुझे कहते हैं आपको स्टमक इन्फेक्शन है, तो उसके लिए फिर मुझे कोर्स दिया था.
So
एंड देन
gastroenteritis?
आफ्टरवर्ड.
Did they mention any names like gastroenteritis, H. pylori, etc.? No?
No.
Can I ask you something, man? You
Yeah.
know, do you have issues with your stomach, constipation, gas issues, etc.? Your food doesn't digest and it just ferments.
मैं टू बी वेरी ऑनेस्ट, यू नो, मैं जब भी खाना खाता हूँ ना, ठीक है, फिर उसके बाद मुझे मतलब ऑल द टाइम मुझे बर्प मैं करता रहता हूँ, मुझे फील होता रहता है.
Bas,
आई
bhai.
फील बर्पिंग ऑल द टाइम.
That's enough, brother. That's, I think. Anything else you want to add to that?
Yeah, and I've been told I've got vitamin D deficiency as well.
Brother, we've
So
all got vitamin D. Never mind us, the Caucasian, the natives of this island, they have vitamin D deficiency. Me and you, it's a lot more difficult for us to get the vitamin D from the sunshine, भाई. तो ये तो सबको है ही है. इसके अलावा
हाँ,
कोई
बिल्कुल.
लेकिन देखें आपकी जो पेशाब का मसला है कि हर 10 मिनट के बाद आप you go and pass urine. तो how much are you passing every time you go to the bathroom? How much?
आप like you know like जिस तरह से नॉर्मल आप करते हो, लेकिन हाँ ये है कि नॉर्मली मेरे साथ ऐसा होता नहीं था. अभी मेरा जो यूरिन है वो बिल्कुल ट्रांसपेरेंट है, बिल्कुल like a water.
So are you having a lot of water then, bhai? Because it's normally transparent when you have a lot of water, which is a good thing to be honest with you.
No, I'm not having a lot of water, to be honest.
Have you checked your blood sugar levels, brother? It could well be.
Yeah.
So they've not. You done the HbA1c test?
They did. Yeah, they did the sugar level test. Yeah.
So you're diabetes. You don't have diabetes.
No.
Are you losing weight?
A little bit. Not like एकदम से जिसमें fall down नहीं होता उससे नहीं है.
How much have you
थोड़ा
lost?
थोड़ा.
How much have you lost in the last 3 months?
You can say about. मुझे weight मैंने किया नहीं है, लेकिन feel like होगा like kg or 2 kg or something.
Okay, so keep listening, please, inshallah, and we'll go through your symptoms and we'll advise you something. Jazakallah. Jazakallah, bhai. Thank you for calling in. Barakallah. हाँ, तो ये हमारे भाई थे. आपने सुना होगा. He called in because he's got issues. He's got pain in the left hand side of his face, this side, and so we were discussing. In fact, we'll answer this question right now. You know, many people come to homeopathic physicians, even the GPs they go to, and they go with these symptoms of where they have pain. Okay, they feel actual pain. Some actual people go to the GPs and they won't even go to the GPs. They'll call 999 and the symptoms they're telling to the responder will warrant an ambulance being dispatched, because these symptoms mimic a person having an acute myocardial infarction. It's like they're having a heart attack. That's how severe they are. They have pain, gripping pain on the left hand side or in the middle of the chest. They have pain that radiates down their left arm into the hand. They have pain in the jaw area. They break out in a sweat. They're very pale. Sometimes they have hypotension. They have low blood pressure. So the person on the other side is rightfully worried. Now, what happens is the single biggest reason for these symptoms are not that he's having at that moment a heart attack. You know, maybe in the future, if people don't care about the diets, they will have it, because it's the single biggest cause of death in the Western world, cardiovascular related disease. Second only. So what's happening is that a person's gut, the gut, the stomach is so important. The gut biome is known as, we have normally, there's a certain amount of bacteria we have, but the certain amount of cells, but the gut bacteria has phenomenal amount of genes inside there. We have, I think, 20,000 genes we have, but the gut bacteria is something like in the millions. It's crazy. The gut is like a second brain, and your 80% of your immune system is in the stomach. In fact, researchers said if you want to have a long life with Allah's hukum, first of all, the hadith says you should be good to your relatives, yeah, and you have a long life, inshallah, and there'll be barakat in your rizq. And secondly, from my personal view as well, is that you should make your stomach in good state. If you're always having dikar, eructations, you're hearing sounds in your stomach, or your stool habit has changed, you're not in a good place. Especially if you're in the 30s and you're going upwards, you need to sort the stomach out. Yeah, the stomach needs to be sorted out, because the stomach, like your teeth health, are a massive indicator of whether you're gonna get big illnesses like heart disease and diabetes, or whether you won't. So please sort your stomach out. So it sounds like our friend who called in, Allah give him shifa, he needs to sort his gut out, and for that you need to have things like enzymes, things that break your food down, like protease, amylase, lipase. You can get these from health food shops. Digestive enzymes. You need to have good, a good company, good acidophilus. You take these, they'll sort the stomach out, because it sounds like you have got, indigestion issues, and this gas, which is caused by food not being broken down, it's releasing, and it goes all the way up through the stomach cavity, and you feel the effects into your face. So the first thing I suggest to you is, you do need further investigation because of your polyuria, where you're having a lot of urine, especially because it's white, which is a big indication of type 1 or type 2 diabetes. But for this other stuff, you need to have digestive enzymes, no water with food, have water half an hour before, 2 hours afterwards, and good acidophilus. Jazakallah. We've got a call waiting. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum assalam. Assalamu alaikum.
Walaikum assalam. जी बहन.
I just wanted to आपका पूछना है, हेयर लॉस के लिए आप कुछ रिकमेंडेड कर सकती थी?
हाँ, हेयर लॉस आप सुनते जाएं, हेयर लॉस, बल्कि ठीक है सिस्टर, जज़ाकल्लाह, आप सुनते जाएं, बताते हैं हमको हेयर लॉस के बारे में भी ये जज़ाकल्लाह। देखिए जज़ाकल्लाह, हेयर लॉस, हमारी बहन पूछ रही है कि हेयर लॉस के बारे में। हेयर लॉस, द सिंगल बिगेस्ट रीज़न, बालों का गिरना, चाहे मर्दों के अंदर हो चाहे औरतों के अंदर हो। तो मर्दों के अंदर अलग वजह है, औरतों के अंदर अलग वजह है। मर्दों के लिए वी हैव समथिंग कॉल्ड मेल एंड्रोजेनॉइड एलोपेशिया, कि आदमी के ये जो नहीं टेम्पल्स होती हैं, तो यहाँ से रफ्ता रफ्ता बाल पीछे जाते हैं। इसकी सबसे बड़ा वजह ये है, आदमी एक्सरसाइज नहीं करते और स्ट्रेस ज़्यादा लेते हैं। You need to exercise, especially those guys who go to university. That's when they start realizing it. First of all, hair loss. They're not exercising. They need to get out, exercise a good half an hour every second day, let the blood run through all the areas, because what's happening is that the blood isn't going to the area. And number two, your showers, these shower heads, they're responsible for a lot of hair loss. Shower heads are really crazy. If you research it, they cause some serious problems to people's hair. So look into them shower heads, and I'll leave it to that. Look at them shower heads, and plenty of exercise for males. Now, sometimes they have this issue that's shared by ladies. Ladies have hair loss. The biggest reason for ladies having hair loss, if they're normally everything else is okay, is this. If they've got restricted diet, that can cause hair loss as well, but then it kind of goes normal, 70 hairs fall out every day. तकरीबन नॉर्मल है, लेकिन अमूमन औरतों के बाल गिरने की वजह ये होती है कि उनके जो सेरम फेरेटिन लेवल्स होते हैं ना, आयन के जो लेवल होते हैं वो बहुत कम होते हैं। हीमोग्लोबिन तो है ही है, लेकिन सेरम फेरेटिन जो आयन स्टोर्स हैं वो बहुत कम होते हैं। तो ये जो सेरम फेरेटिन स्टोर्स हैं, बाज़ लोगों को फेनिक्यूस एनीमिया होता है कि अंदर ये जो सेल्स है वो ख़राब हो जाते हैं, उनके अंदर ये जो मतलब है कि आयन नहीं आती, जब आयन नहीं आती तो न्यूट्रिशन नहीं जाते हैं, खून अच्छी तरह नहीं जाता हल सल की तरफ। सो यू हैव ईदर फेनिक्यूस एनीमिया और यू हैविंग लेस आयन कंटेनिंग फूड्स। तो ब्लड टेस्ट करवाएं, हीमोग्लोबिन लेवल चेक करवाएं। अमूमन तो हीमोग्लोबिन लेवल ही चेक करते हैं, आपके आयन का स्टेज क्या है। औरतों के लिए तकरीबन 12-13 मिलीमोल्स पर लीटर ब्लड होना चाहिए। अगर इससे कम हो तो ज़ाहिर अमूमन कम, अगर हीमोग्लोबिन लेवल ठीक भी हो तो इसकी वजह यानी ये बात आप ना समझें कि आपके जो सेरम फेरेटिन लेवल जो आयन स्टोर्स हैं वो भी ठीक है। क्योंकि क्या होता है कि जिस्म के अंदर हीमोग्लोबिन लेवल जो होते हैं वो ठीक रहते हैं, क्योंकि जिस्म कोशिश करता है कि इंसान एक हद तक इनके जो तवाज़ुन है, it should be, the body tries to maintain equilibrium, so it'll get some from there, get some from there, and keep an equilibrium. When you have a bit of a shock, you may fall down, you might faint because it's so less. But generally, hemoglobin levels being normal, like 12 for ladies, isn't an indicator that you're not severely depleted of iron. You need to have a serum ferritin check, that will tell you the state of your iron levels. So please Ben, जो आप पूछ रही हैं बाल के बारे में, सबसे अव्वल बात ये करें, आपके ब्लड चेक करवाएं, आपके जीपी से आपके आयरन लेवल का पता करें, हीमोग्लोबिन लेवल भी करवाएं, लेकिन इससे ज़्यादा आप सेरम फेरेटिन जो आयरन स्टोर्स है उनकी तरफ आप रुझान करवाएं और वहाँ आप रुझान वहाँ दें। इसके लिए अच्छे अच्छे आयरन की दवाई हैं, स्पटोन भी है और एक आयरन बाइग्लाइसिन है, ये बहुत अच्छे हैं। आयरन बाइग्लाइसिन और स्पटोन ये बहुत अच्छे हैं। आपके जो जीपी देते हैं आपको फेरस फ्यूमरे, फेरस ग्लूकने, फेरस सल्फे, इनसे बहुत कम अब्जॉर्प्शन होती है और इनके साथ कब्ज़ भी होती है और पेट के भी अंदर एक किस्म की यू ऑफ दिस तकलीफ। जज़ाकल्लाह। तो होपफुली दैट शुड हेल्प यू। Going back to our sister who called in for her brother who's 70 years old and who has BP and kidney issues, I mentioned earlier on that this remedy that I normally use is something called berberis. Berberis is a medicine which is very, very good for the kidneys. It helps in passing the stone. It helps with these neuralgic pains people feel. And kidney stones and gallbladder colic, kidney colic and gallbladder colic, it's so painful. Allah Akbar. Some have described it as, equivalent as what the ladies feel when they're giving birth. It's excruciating. I've seen big men kind of screaming. They have to give them, things like, what do they give them to kill their pain? They give them, massive opium-based pain relief to kind of sedate them. It's very excruciating. And our brother, our Haji Sahab, 70 years old, ज़ाहिर बात है, it's very, very difficult. तो ये जो berberis है, berberis mother tincture आप मंगवाएं, इंटरनेट के जरिए आप मंगवाएं, अच्छी कंपनी से मंगवाएं, और इसके जो टिंचर है ना, टिंचर भी मंगवाएं और होम्योपैथिक 12x आप मंगवाएं और दिन के अंदर 3-4 मरतबा हर 2-3 घंटे के बाद एक गोली हाजी साहब के हवाले करें। और this is what other homeopathists will prescribe all over the world for kidney stones. Berberis 12x a few times a day, 3-4 times a day, and then mother tincture 10 drops 2-3 times a day. इससे इंशाल्लाह उनको बहुत ही फ़ायदा होगा, बहुत ही फ़ायदा होगा। हाँ, हम ये बता रहे थे इससे पहले फ़ोन कॉल से पहले कि रिलैक्सेशन का बेहतरीन तरीका क्या है और ये जो इंटरनल स्ट्रेस और इंडोजीनस और एक्सोजीनस जो डिप्रेशन है इसको हटाने के लिए वही बात है। अव्वलन आदमी ओमेगा 3s बढ़ाएं। ओमेगा 3s मच्छी के अंदर होते हैं और मच्छी कौन सी लें? ये जो सामन आप लेते हैं ना, ये जो सुपरमार्केट से आप लेते हैं ना, तो उमूमन ये फार्म्ड फिश होती है। Farmed fish is very toxic. Some people say farmed salmon is one of the most toxic foods in the world, if not the first one. You need to get wild Alaskan salmon, or you need to get, stay away from farmed fish. It has to be, a wild fish from the ocean and the rivers. Wild Alaskan salmon is fantastic. It's very good. ये आप लें, खुद भी खाएं, बच्चों को भी खिलाएं. Especially them people who have got anger issues, उनको बहुत फायदा होगा. 1-2 दिन से नहीं. I'm talking about months. 2-3 months keep giving to these children and to anybody else who got the issues. It'll help with the depression as well, and it'll help with stress, anxiety. But the biggest thing I suggest for anybody, so that's the omega 3s. You can find these in nuts, badam, pistachios, akroot, chalgose, all these nuts, Brazil nuts, cashews, almonds. These have got great amounts of omega 3 fatty acids, but when you're having these, avoid these biscuits. Second thing you need to do is exercise. It's so important. Exercise, it helps with every single thing. There's so many benefits. Let me just run through this list of, let me run through the list. This is how good it is for you, especially the young guys who've got issues with hair loss. They should be, or other, cold hands and feet. They need to exercise. The blood has to be running, and they need to improve their diet. So it helps you control your weight, reduces risk of heart disease. Phenomenal. It's so good for you. Helps your body manage blood sugar and insulin levels. In fact, next week, I'm going to be talking about a phenomenal breakdown in diabetes. It's going to be really, really great and really beneficial. Make sure you tune in. So back to exercise. It helps your body manage blood sugar and insulin levels, reduces the risk of heart disease, helps you control your weight. It helps you quit smoking. SubhanAllah, it makes it easier for you to get over the cravings for cigarettes. Improves your mental health and mood. You need to go out, especially to the parks. Take your children with you. Do a half an hour Monday, Wednesday, Friday. If not, then do it Saturday, Sunday. Very important. और स्ट्रेस की बात ये भी है कि every hour if you're behind the desk you need to get up, and you need to move around, exercise. I can't say enough for these kind of exercises where a person is really pushing his body. So jogging is very good. Certain martial arts, wrestling. Wrestling is, if I'm not mistaken, Sunnah of Rasulullah sallallahu alaihi wasallam. Ye jo combat sambo. If you have time, we'll actually get an expert in combat sambo. One of our local brothers, Yannick Mizepo, inshallah. And this guy's a 3 times African combat sambo champion, so we'll get him in for some tips. But exercise strengthens your bones and muscles, reduces your risk of some cancers, reduces the risk of falls, improves your sleep, improves other intimate health, and increases the chances of you living longer. You need to, everyone needs to exercise. So inshallah, I hope, and you can take your family, do a family thing, take all your family, go for walks, and make it fun so everyone's enjoying it. I hope this has been beneficial to everybody, and I hope everyone who's called in has benefited to some degree. There's no time, but I wanted to mention exercise which helps you relax next time, inshallah. And also next time we'll be talking about an amazing breakthrough in diabetes based on this book, How to Reverse Your Diabetes in 2.5 months, Breaking Edge. Please join us then, inshallah. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh.